I used to be one of the Baltimore Arabs, and went up and down the streets selling produce. I love talking to people and they buy my little produce from me and stuff like that.
So Baker Bay is a supportive housing client who has experienced homelessness for a long portion of his life.
I got in a little trouble, came home from prison and didn't have nowhere to go. So I was ripping and running and laying in old houses, just somewhere they had to sleep. So I got tired of it. So I went to healthcare for homeless.
Over the last several years, there's been a paradigm shift from the idea that people need to be ready for housing in some way, as opposed to, and people need to prepare for housing. And really this shift where people are considered to be ready because they're here, because they're alive.
Homelessness exists because our nation has disinvested in affordable housing. We look at how devastating homelessness is to health. We've got people who are dying on the streets because they don't have a stable place to stay. And we finally got to the point as an organization where we find it unacceptable that we don't have sufficient housing resources for them. We are committed as an organization to developing stronger relationships with local officials, community leaders, landlords, hospitals and other health systems to invest in sustainable housing for people experiencing homelessness now and into the future.
So elected officials and policymakers have been getting on board with Housing First much more rapidly. So you are seeing many more stakeholders come to the table and do housing and healthcare partnerships. There are fundamental public policy changes in our community that need to happen. And Healthcare for the Homeless traditionally has been the one to take a strong stand.
The strength of our program is really hinged on having strong partnerships with our landlords. We over time have cultivated great relationships with landlords, and it really is about getting out in the communities.
When Baker came to the supportive housing department, he already knew where he wanted to live, and it was a place he had lived before and had a good relationship with the landlord. It went a little bit faster.
Property managers, all we can do is the housing piece, but Healthcare for the Homeless, when they introduce their program to a property manager, we get the full picture. Since I've been working with them, I had 100% of all of them being very successful.
There I was, and Mrs. Carroll started working with me. And she would say, just do everything I ask you to do, and you can get it.
We know that the vast majority of people that are coming to us, if homelessness is the only traumatic experience that they've had, they're very fortunate. I
wasn't going to see the doctor or nothing like that. I got high blood pressure. As long as they help me with my medication and all that, I do everything they ask me to do.
Housing is healthcare.
Our peer providers are critically important to the work that we do, in the sense that they themselves have lived experiences with many of the things that our clients are facing.
When you first starting to do something, you doubt it. You doubt that you can't get it done. It's not going to happen for me. And that's where he was at. He was in a point like, yeah, Mr. Reed, I've been trying to do this for a long time. You trying to encourage him, look, we're going to get through this. We're going to make this happen. The day that we found a place and it finally passed inspection, he couldn't stop smiling, right? And even though he don't like to smile that much, and the thing that impressed me the most is when he got his place. He showed so much joy in having this place there. He had his apartment looking immaculate. It lived in. It looked at, it was saying, I've been waiting to do this for a very long time.
I've been housed now as far as me having my own now, I never had it before. Look what I got.